functional family therapy is derived from structural family theory. Sexton and Alexander in 2002 cited that research demonstrates the efficacy of family therapy as a successful intervention with at-risk youth by showing 3 systemic qualitative reviews of over 30 years of research on the effectiveness of family interventions. Marshall cited in 2018 that functional family therapy works well with children and adolescents with behavioral problems. Onodera cites in 2006 of an interview with a leading mental health expert, Dr. James Alexander, who reported that they did an extensive study with the Center for Study of Prevention of Violence, the Center for Disease Control, and the National Institute of Justice, combined efforts to discover effective treatments for youth experiencing behavioral problems. They explored over 500 programs and they only found 10 effective interventions. Functional family therapy was 1 out of the 10 treatments found to be a successful intervention. During their exploration of these programs, they used strong empirical records, including randomized trials. Sexton and Alexander in 2002 found functional family therapy to be empirically supported in 13 clinical research studies as an effective treatment with at-risk youth. Darnell and Schuler in 2015 cited additional research of a quasi-experimental study demonstrating the effectiveness of functional family therapy with a diverse sample of at-risk youth. Another research study yielded empirical support for the efficacy of functional family therapy for youth with behavioral problems. In this study, functional family therapy was compared to YCM, which was a case management program for youth. The study utilized a diverse sample of youth and the strengths and needs assessment as a tool to evaluate the outcomes of functional family therapy. Both interventions provided a positive effect. However, functional family therapy provided more improvement overall when comparing improvements in life domains from the strength needs assessment, such as improved behaviors at school, home, and improved family functioning. Also, the study found reduction of behavioral problems, an increase of healthy family behaviors, and an overall improvement in family functioning. Marshall cited in an article in 2018 that functional family therapy works well with children and adolescents with behavioral problems. Onodera in 2006 cites that functional family therapy is short-term and less expensive than other treatments and can be generalized for short and long-term behavioral changes. Functional family therapy has several important tools that include emotional, cognitive, and behavioral components, which utilize conflict management, parenting skills, communication skills within the family, and assesses individual and community risk and protective factors for the client and the family. It is a strengths-based approach that maximizes strengths and creates a strong alliance between family members and the practitioner by accepting the family where they are in the beginning, which is a core value for social work. Functional family therapy has 3 distinct phases that are beneficial in the intervention with the family. The first phase is engagement and motivation. The second phase is behavioral change, and the third phase is generalization. In the first phase, the goal is to engage and motivate the family by teaching conflict management, stress management, parental training on providing healthy structure, and communication training to teach healthy communication among the family members. The second phase is behavioral change, in which the families track their problem areas and present them in the therapy session. At this point, the practitioner has the family to act out these high conflict scenarios by role playing. Then each family member evaluates and examines better ways to resolve their problems. The practitioner is a guide in this process of problem solving and communicating effectively. In the third and final phase of functional family therapy, called generalization, the family members act out potential future conflicts and problem solve. In addition, the practitioner ensures that the family members can use the skills they have learned effectively and can effectively problem solve. Finally, the practitioner ensures that the family has social supports in the community to continue their success as a healthy, functioning family. Onodera in 2006 reports that functional family therapy is a strengths-based approach that maximizes strengths and creates a strong alliance between the family members and the practitioner by accepting the family where they are in the beginning, which is a core value for social work.